Hi, everybody. Welcome to my video today. I'm Dr. Prabakar, OB-GYN, the Fibroid Doc. Today, we're going to be talking about your pre-op power moves, the 5 things you must do before your fibroid surgery. So I'm a OB-GYN, as I mentioned, and I'm a minimally invasive surgeon. So I do a lot of surgeries for fibroids in my practice out here in California. And let's briefly talk about the 2 major surgeries that women have for fibroids. And there are many treatment options, medications, procedures, minor procedures, but I'm going to be talking about the 2 major ones, and that is the myomectomy and the hysterectomy. So myomectomy is removal of the fibroids. Hysterectomy is removal of the uterus. These are the 2 biggest surgeries women are having today for removal of fibroids. And most women are having this in a minimally invasive approach, which means we make a few tiny incisions in the belly, anywhere from 3 to 5, and we're able to do the whole surgery through these tiny holes. Pretty amazing, isn't it? Um, and then we've also got an abdominal approach or an open approach, which is a larger incision, like a almost like a C-section scar. If your fibroids are many or really large, sometimes we do have to do it that way. So those are the kind of the 2 major ways in which women are having these surgeries done. But prior to surgery, think about like a trip that you're taking. Maybe you're going away for 2 weeks to Italy. Think about all the things you have to do to prepare, right? It's just not getting your ticket and your hotel. You've got, how are you going to get to the airport? Who's going to drop you off? And then, what kinds of clothes do you have to pack? What about the weather? And, sunscreen. And, do you have other medical conditions? Do you need to carry all your meds with you? There's so many other things that go into preparing for a trip, right? So I want you to think about surgery the same way. It's not like, oh yeah, I got my date, got my surgeon, I'm going to show up and I'm going to get my surgery. There's a lot more you can do to prepare so that you can actually go through it as stress-free as possible and actually set yourself up for a better recovery. The more you prepare ahead of time, the better it is later. And please stick around till the end because I'm going to tell you the number 1 pitfall in the whole pre-op period. And this actually happened to me. So stick around for that. Okay. So number 1, first power move is get in tune with your body. Again, this is not something that you just show up to the operating room, you get some anesthesia, and bam, your surgery is done. I mean, you could approach it that way, but if you have a little work to do, this is the time to really get it done, right? So you want to look at, your overall health. Are you a healthy person? Is your blood pressure well controlled? Are you in normal weight? These things all matter because there's the surgical part where we're cutting out the fibroids, but there's also the anesthesia part, right? You're going to sleep and you're getting these medications and a machine is breathing for you. And there's a lot of things that make that process go smoothly. And so we want to really prepare ourselves the best we can prior to surgery. So making sure we're at a normal weight, we're not smoking. Even if you're somebody who smokes, please stop at, even 2 weeks prior to surgery still makes a difference. Okay. And then if you're somebody who has diabetes, this is a time to really get those blood sugars under control because, again, post-op healing, you are at much higher risk of infection if your sugars are really high. And what else? Your blood counts should be normal. If you're somebody who's getting fibroid surgery because you have been bleeding really heavily, what is your iron level? What is your hemoglobin? These are things to really pay attention to. Maybe you do need an IV iron transfusion. Maybe you need oral pills. Maybe you need a blood transfusion because your blood counts are so low and you have surgery coming up. So these are things to optimize. And then are you moving well? So are you, getting some exercise? Are you walking? Are you sleeping well? 7 to 8 hours at least every night, because again, this really helps repair your body. It helps with immune function. And then are you eating well at the same time? So are you eating low fat, anti-inflammatory foods that are heavily plant-based? is what I recommend, and trying to cut out a lot of processed foods, really trying to eat healthy and prepare yourself well for surgery. So really getting in tune with your body is the first power move. It's super, super important. And I think many, even in medical school and even in training, I don't think we really spent a lot of time focusing on this. We spent a lot of time focusing on surgery and how to do it well and learning all the steps and post-op and everything, but I don't think we really emphasize the pre-op as much. And this is a perfect time to really think about that. Okay. Um, Number two, discuss the game plan with your surgeon. And I cannot emphasize this enough. Sometimes I see patients who've had surgery, previously, and I ask them some questions like, "Hey, what was the plan with the surgeon?" And they're like, I don't know. I just went and I had surgery." So please advocate for yourself and have a detailed discussion with your surgeon about the game plan. So, for example, do you need more imaging? Maybe you had an ultrasound for your fibroids. Maybe your fertility doctor did it in their office or someone did it in their office. Do you need an MRI maybe before surgery? So find out about the imaging. And also, what type of incisions are they planning on using? Are you having a robotic surgery? Are you having an open surgery? How many days are you going to be at the hospital? Really find out about this. What is their plan for blood loss? Like, do they think you're going to lose a lot of blood because of how many fibroids you have, or maybe not? Maybe you just have one fibroid and they're not anticipating that you're going to lose a lot of blood. But if you are going to lose a lot of blood, what's the plan? Are they using a cell saver? What about blood transfusion? Is that readily available at the hospital? So these are all questions you want to ask ahead of time. Um, and then also, what medications should you stop? Like, really look at your list and see other vitamins that you're on that need to be stopped, or other medications. We have a lot of patients on Wegovy or Ozempic, other GLPs. These need to be stopped 1 to 2 weeks prior to surgery. Your pre-op clinic will tell you, which one it is, but that's something you want to pay attention to and make sure that you're following those guidelines. Okay. Um, Number three, you want to assemble your support squad. Okay, so this is kind of your cheerleading team, if you will. It could be a spouse, a partner, a family member, or friend. Please find out who is going to be picking you up right from the hospital. You cannot take an Uber home from the hospital, so you want to find out like who is going to do that. And also, do you need to arrange for childcare, pet care, other things that need to be done in your house, laundry? If you have really little children, you probably can't pick them up right away for a couple weeks. So, really making sure you've got the support ahead of time, and really having that dialed in will take a lot of stress off of you. So, make sure you do that. And also coordinate with your work. If you're somebody who is working outside the home, maybe you need some FMLA paperwork done, or your EDD paperwork. Maybe your employer wants a form for you to fill in. Please bring these ahead of time to your surgeon's office, so that all these things are taken care of. As much as you can do to prepare ahead of time so you're not stressed afterwards is going to be key. Okay, hopefully you guys are getting some good tips here. Number four, prepare your recovery zone, right? So when you go home, what's the plan? Are there stairs? Some patients will say, "Oh yeah, I have to climb like 2 flights of stairs to even get into my house." Is that going to be a problem? Do I need to stay somewhere else? Um, and then how many flights of stairs can you climb? Do you need to move your bed maybe from one floor to the other, or sleep on the couch for a couple of days? So whatever that situation is, you want that figured out prior to you going home after surgery. Um, I would also highly recommend an abdominal binder, just to keep your stomach like tucked in, your abdomen tucked in. A lot of patients find that comfortable after surgery. So ask your surgeon about that. Maybe that's something you just want to order on Amazon, have that ahead of time. Have some gum. Chewing gum helps you move gas, and move your bowels a little bit faster. And so that's something you want to have. Maybe you want to have some ice, some heat packs ready, books to read, have some food pre-cooked and like ready to go, so you're not having to like worry about that. So whatever those kind of comfort things are, make sure you've got that all lined out. And oh, I forgot to mention medications. This is a really big one. When it comes to recovery, make sure you know what medications you're supposed to be taking and when. For my patients after fibroid surgery, I have like a very specific regimen. Every 6 hours, you got to take this plus this, then you got to add that, so find out exactly what you're supposed to do ahead of time. And, whoever's going to be helping you at home, make sure that they also know, because maybe you're going to be a little bit out of it for the first like 24 hours. You want to have all that like really nailed down. Sometimes people feel nauseous, so maybe you want to have some peppermint tea also there. So really take a look at your environment, figure out what you need to help recover, smoothly. Okay, and then the last one, number 5, is just set expectations, right? So when you have surgery, okay, your surgeon says it's going to be a robotic surgery. Maybe you're going home the same day. Um, when am I really going to be able to walk around the house? When am I going to be able to walk around the block? When can I do some yoga? When can I go to the gym? You would have really discussed all these things ahead of time with your surgeon, but you really want to have realistic expectations. So if you're someone like me who works out 4 to 5 times a week, maybe sitting around and being a little more slow is not going to feel comfortable, and maybe you're just itching to get out there and move. But just really setting the expectation that that may not be happening right away is really important. And then also with work, some people ask me, oh, I work from home, can I just open my laptop and start working the next day? Well, I mean, you could, but it's probably not a good idea, right? You're not going to feel well the first couple of days after surgery. You really want to give your body a rest, especially for those who undergo hysterectomy. Everyone always tells me that they feel super fatigued. And so you want to realistically tell your boss that you're not going to be there for at least 2 weeks, even if you're somebody who works from home, right? So, or maybe you work for yourself and you're like, well, I don't really want to take 6 to 8 weeks off. I want to be able to go sooner. Well, you probably can do some work, after the 2-week mark. So just having some realistic expectations around that will help your recovery. Okay. And then, if you get anxious, if you have unexpected pain, what are you going to do? So really having a plan for that. Maybe it's prayer and meditation. Maybe it's deep breathing. Maybe it's yoga practices, whatever it is, just having a plan for that also helps. Okay, so those are the 5 pre-op power moves that I wanted to share with you guys for setting yourself up for a good surgical experience and for a good recovery. And as discussed, if you've watched this far along, I'm going to tell you the number 1 pre-op pitfall. Okay, and this happened to me. I was a fellow, and I was taking call at the hospital, and it was actually OB call, and I had to do a C-section. It was like 5 in the morning. I had to do a C-section, and it was an emergency C-section, and it's not like I had a long-standing relationship with a patient or anything. And as we're rushing to the OR, I'm about to like put on my gown and everything. She's like, "Oh, by the way, I don't accept blood. No blood transfusion." And I literally, you know, I started to feel a little panicked because y- y- we never know what happens during surgery, especially an emergency section where we usually lose a lot of blood anyway. Um, but the surgery had to be done. Luckily, everything was fine and she did not need blood. But, because of some religious preferences, she was not going to accept blood. And and there are some people who don't accept blood, even if it means death, right? Um, so if you are in that camp where you do not accept blood, please, please tell your surgeon that, okay? Luckily, when you're going through planned surgery, these things come up a little bit more compared to like emergent surgery. But if you don't accept blood, there's a whole other series of things that need to be done to prepare for surgery. So your surgeon should know, the anesthesiologist should know, and your team should know. And so this is something I routinely ask my patients now. Do you accept blood? Are you okay with a blood transfusion in life-threatening emergencies? This is something you definitely want to think about as a patient and, of course, as the surgeon. But yeah, that was definitely a big pitfall in that situation, and would be a pitfall in fibroid surgery, because with fibroid surgery, we all know that we can lose a lot of blood, especially if there are lots of fibroids. It is a rather bloody surgery compared to a lot of other GYN surgery. And so if you have issues with taking blood, accepting blood, please let your surgeon know, like, right away, not at the last minute. Like, this is something that should be discussed um, early on. All right. So hopefully this was really helpful for you guys in trying to decide and figure out how to prepare for fibroid surgery. Um, and if you've enjoyed this video, make sure you like it, subscribe to the YouTube channel, and share it with a friend who may be going through surgery. And make sure you hang out for my next video, which is the bounce back blueprint. We're going to be talking about post-op recovery and all the things that you need to know to recover really well after your fibroid surgery. So I'll see you at the next video. Bye.